Good evening. 3 young doctors working in the A&E department of a London hospital have issued a stark warning to Britain on the day the death toll from coronavirus rose by 87, the biggest daily rise so far. 422 people have now lost their lives, but the doctors warned that they are seeing people in their 20s and 30s who are very sick, and they said that the surge of cases was only just beginning. They urged everyone to take the government's new restrictions very seriously. Today it was revealed that a new field hospital is being opened next week at a conference centre in East London that can take up to 4,000 patients. And the government has launched a volunteer scheme to recruit 250,000 people to help vulnerable people cope while they're confined to their homes. With the latest this evening, here's our health editor, Hugh Pym.
We are standing at the foot of the mountain and we are looking up and we don't know where that summit is. We don't know what we're heading towards.
3 doctors at a London hospital tell me what they are now seeing daily on the front line.
Patients in their 20s, patients in their 30s. We don't know what the outcome of some of these patients will be. They will go to intensive care. They may be in intensive care for some weeks, and some of them will die. And it's completely heartbreaking and harrowing.
London is ahead of the rest of the UK with the coronavirus. They're warning other areas what might happen.
So we have all of these people who are incredibly critically unwell, and people are dying alone. People have no company, they have no comfort, and that's incredibly difficult for healthcare providers who are trying to help people recover, or in some cases pass away with dignity and kindness. And we are stretched as it is, and that's incredibly hard.
But they're ready for whatever comes next.
There's a lot of training that's going on to prepare for this onslaught that we are guaranteed to receive in the next few weeks and months. And I think that there's a positive, a tentative positive, that we are trying to prepare for that as best we can.
In a hospital bed in Durham, Michelle had a plea to the public: be careful and responsible.
I'm begging you, please be careful, be responsible.
Some patients receiving care for different conditions, including cancer, are worried about what will happen as hospitals postpone some treatments to focus on coronavirus cases. A bowel cancer surgeon told me some procedures were having to be rescheduled.
It's quite terrifying to them. These are patients who were expecting to have surgery done, and now they're facing uncertain dates. They're facing hospitals that are going to be full of patients with COVID. And we're doing our best to deal with both the psychology of the situation, but also get them to timely care.
It's a lot of pressure on everyone.
Marsha is having chemotherapy in a private ward at an NHS hospital. She's been told it's not certain it'll continue there.
I'm unsure if there'll be enough nurses that will be able to look after me, if I'll even be able to get my treatment. It is all very scary because once you start chemotherapy, you need to carry on. And so if I have to pause it, I won't know for how long I'll have to pause it. I don't know then what it will do for my health.
One hospital trust has postponed chemotherapy treatment along with other outpatient appointments for 2 weeks while they prepare their wards and staff for an influx of coronavirus patients.
We are increasing our preparations for care of patients with COVID-19, and we're seeing increasing numbers of admissions to hospitals. And we're very conscious that our cancer patients are at particular risk, particularly if they develop COVID-19, they can become seriously ill.
Every hospital's preparing, and the government announced there'll be a temporary new one here at the XL Conference Centre in London's Docklands, with room for 4,000 patients. More will be created at other locations. The planning's on a big scale, but the NHS will need every bed it can find. Hugh Pym, BBC News.
Our medical correspondent Fergus Walsh is with me now. The surge has started, is what those young doctors were telling us, and then you see plans for that huge temporary hospital. It really does give you a sense of what is coming.
It does, Sophie. We are at the very early stages still of what looks like being a very major epidemic here, with cases doubling every 5 days. Now, most people will have a mild illness, about 80%, but the numbers from the minority of cases who need hospital treatment, oxygen for pneumonia, they really could have a major impact on the NHS. And a conference centre, an exhibition centre, in Docklands being set aside for 4,000 beds gives you a sense of what the NHS is expecting, and the peak of cases may not be until sometime in May.
Europe is very much the epicentre of all this at the moment. What is the global situation though?
So it's worth looking at the global spread of cases. Now, it took 67 days to reach 100,000 confirmed cases, but then it took just another 11 days to reach 200,000 coronavirus cases, then just 4 days to reach 300,000, and then 2 days to hit 400,000 cases. That was today. And that shows, Sophie, the exponential growth of this virus globally, and it's still not stopping.
And the first cases of this were reported, almost 3 months ago. What is the situation in China now?
Well, it's really worth looking at the daily reported cases in Hubei province, home to 60 million people. Now, they had their first confirmed case in Wuhan on the 31st of December, and then they went into total lockdown, far stricter than here, on the 23rd of January. But their cases carried on rising for a couple of weeks before the restrictions had an effect. Now, they've been falling ever since then, with only one case in the past week. Now, after 2 months, China is going to start lifting those restrictions in Hubei province. And the big question is, have they contained this virus, or will there be a second wave?
Fergus Walsh, thank you. Well, strict new measures have come into force across the UK for the next 3 weeks, with people being told they can only leave their homes for very limited purposes. You can go shopping for basic necessities such as food and medicine. These trips should be as infrequent as possible. You are allowed one form of exercise a day, such as a run, walk or cycle, alone or with people you live with. All gatherings of more than 2 people are banned, apart from your family. You can leave home for any medical need or to care for a vulnerable person. Travel to and from work is allowed, but only where work absolutely cannot be done from home. But there was a warning that those restrictions would be tightened further if people flout the rules. Here's our political editor, Laura Kunsberg.
I live with my husband and my 3 children. I'm also living with the coronavirus.
After struggling with a chest infection, she couldn't shift. Lexi Taylor from Suffolk believes she has the virus and is coping with her 3 kids. She says her husband's being forced to still go to work on the factory floor.
I need him here to support me and to stay indoors like the government have said. Stay at home. Don't go out for anything that's non-essential.
What is essential? Thousands packed the trains during London's rush hour this morning, stretching the loopholes perhaps. Crammed on tubes, cheek by jowl, on busy building sites too. Is it really possible to keep our distance? Scotland's First Minister isn't sure.
We've been asked specifically about construction sites in Scotland. We would expect them to be closed unless the building that is being worked on is essential, such as a hospital.
Here's the dilemma. Last night, the Prime Minister was firm. As many of us must stay at home as possible to get a grip on the spread of the virus. That's black and white. But ministers don't want the economy to grind to a halt. So if you can only do your job when you're physically at your place of work, and if you can stay safely more than 2 metres away from other people, then it is OK to go. There are shades of grey.
Ministers have changed how they work. This isn't an arcade game, but this morning's cabinet meeting. And today, for the first time, journalists were asked online to put questions in number 10. The Health Secretary began with the quickening pace of the disease.
Very sadly, overnight, 87 more people have died, bringing the total to 422. And our hearts go out to their families and their friends. Yesterday, the Prime Minister announced the most radical steps yet to slow the spread of this virus. And these steps are not requests, they are rules.
We've heard from many members of the public today who are being told that they should go to work by their boss, even though they don't think their work is essential right now at this moment, and they don't feel they can stay safely 2 metres apart from everyone else there. The message to many people has not been that clear from the government. Who are they meant to listen to? Their boss or the advice?
The advice is crystal clear. Go to work where that work can't be done at home. And if you're a key worker, for instance, if you work in the NHS and social care, then you should go to work.
And there was rather unlikely public health advice for couples who don't yet live together.
Test really carefully your strength of feeling. Stay with the household, either together or apart, but keep it that way while we go forward.
A lighter moment, maybe, in a serious time when the limits on our lives are growing. Police in Plymouth, politely asking drivers where they're going. So much change already, and this really is hardly the start. Laura Kunsberg, BBC News, Westminster.